Hello, if you're seeing my face for the first time, my name is Joanne and you're welcome to my channel. Please take 1 minute of your time and subscribe. Please turn on the notification bell so that you get to be informed once I upload any video. And if you're a returning subscriber, you are welcome. And on this channel, we talk about nursing, we talk about food, we talk about health, we talk about marriage, motherhood, lifestyle, and so many other things. And so, please stick around and watch the end of this video, and trust me, you will gain 1 or 2 things. And so, you are all welcome to my channel. And so, today we are going to be talking about how to treat oral thrush. And I would also like us to note that oral thrush can also be called yeast infection or candidiasis. And we have particularly 4 categories of individuals that are prone to this, although it is not limited to just these 4 categories of individuals. And so the first group of individuals are those with very low immunity. And then the second categories of individuals are those that have been long used in the use of antibiotics. They have stayed so long, the use of antibiotics has been very prolonged. What this antibiotics does is, it destroys the normal flora that's supposed to be found in that particular environment. When we say normal flora, there we mean the microorganisms that are supposed to be existing in that environment. These antibiotics tends to destroy them and push them off, leaving that place vacant. And once it is vacant, another kind of organism takes over, thereby causing this. And then another group of individuals that are prone to this are those with health issues. When I mean health issues, diabetic patients, patients with HIV/AIDS, they are also prone to developing this health challenge. And another group of, the 4th group of individuals are those that have this dietary modification, where I eat this, I don't eat this, I like sugar, and so I just like everything that's sugary. And so with this one, you are prone to eat, especially for those that do more with sugar. And so it therefore means you have to cut down your sugar. If you are this person that always want to lick ice cream, from ice cream to chocolate, from chocolate to sweet drinks and all, you are exposing yourself to this health challenge. And so now, how do we treat? That is what we will now be doing next. And so if you have watched to this point and you have not subscribed, I don't know why you. Please subscribe. And so let's keep on. So how do we treat this health challenge? How do we go about it? The first and most important thing you have to do is, number 1, you do frequent oral rinse. Oral rinse is not just to carry water and rinse. You use warm water with salt. When you do this very frequently, it tends to slowly take off this challenge, because it is a challenge, trust me. When you go in public and you cannot open your mouth, in some other people it takes like some portion of the mouth, some other people patches, and then for some group of individuals it covers the entire tongue. The entire tongue is white straight away. And so when you do this oral rinse with warm water and salt, it tends to slowly kill those microorganisms there, slowly put them off. And if you do that in your period of treatment, you see that you will have that thing cleared. And then the second thing you do is you change your brush very often during this period of treatment. If your treatment is to go for 2 weeks, or let's say a month, you change your toothbrush frequently. Because when you use a toothbrush today, and then you use it for like 3 weeks, trust me, that toothbrush, if you check inside of the toothbrush, the dentist will tell you more of this. If you check inside, you see that you have some white things that are in your toothbrush. Please trash that and get a new one, especially during this period of treatment. And then the 3rd thing we are going to be talking about today is, rather than using your toothpaste to brush your mouth, it is ideal that you use baking soda. You just use the head of your toothbrush, touch on the baking soda and you brush, and then you gently scrub your tongue, because if you tend to do any hard scrub, it will lead into bleeding, and you don't want that. And then the next thing you're going to do is, for this period of treatment, it is ideal that you change your toothpaste regularly. Change it on a regular basis for this duration of treatment. And then for the last one we are going to be looking at for today, we are going to be looking at drugs. This drug I am talking about is not self-prescription. You will go to your doctor. The doctor will find out the particular drugs that suits you, because the drug that is suiting you may not be the same that is suiting me. And so he or she will particularly know those ones that will have more effect on you, and then those ones will be prescribed. And trust me, when you put all this together, you will see that in no time you're off and your tongue is back to the pinky nature it should be having. And so we have come to the end of this video. I hope you have learned one or two things. And so please leave in the comment section what you have learned from this video. Thank you very much. Bye bye, and see you in my next